have not responded to El-Rufai's latest move. Lupe Asom, TVC News, Kaduna.
As Nigeria joins the rest of the world to mark the International Day Against Drug Abuse, the World Drug Report 2024, launched by the United Nations Office on Drugs and Crime, says the emergence of new synthetic opioids and a record supply and demand of other drugs has led to a rise in drug use disorders and environmental harms. Siphon Essien reports.
It's World Drug Day, and efforts are ramped up to combat the global drug problem. According to the 2024 World Drug Report launched by the UN Office on Drugs and Crime, the emergence of new synthetic opioids and a record supply and demand of other drugs have compounded the impact of the world drug problem, leading to a rise in drug use disorders and environmental harms. In Nigeria, the fight against drug abuse and trafficking has recorded some achievements despite the challenges.
Indeed, never has the world's drug problem been more dire than it is today, as we continue to record increasing illicit drug supply and consumption, ever more agile and globally interconnected trafficking networks, ill-equipped health services, overstretched law enforcement, and unprepared communities and families.
We have used a vehicle, War Against Drug Abuse, WADA or WADA. WADA is a social advocacy initiative used to campaign vigorously at the grassroots and create awareness for our people to shun illicit substances.
Even after now, the federal government is bent on taking the war a notch higher.
I commend and urge everyone to redouble their efforts to combat drug abuse and trafficking in the country. On this score, we wish to reassure you of this administration's support.
Part of the campaign against drug abuse involves raising awareness among young people on its impact.
That we need to invest in the prevention and the treatment of drug abuse.
We believe that if we teach them, we create awareness. The most effective way of prevention is to create awareness, create knowledge, sensitize children of the danger in drug abuse.
The theme for this year's event is "The evidence is clear, invest in prevention." This is partly because the number of people who use drugs rose to 292 million in 2022, a 20% increase over 10 years. Siphon Essien, TVC News, Abuja.
Director of Media and Advocacy for NDLEA, Femi Babafemi, joins me on the news at 10 for more on this. Good to have you join us.
Thank you. It's my pleasure being with you again.
So we've seen the NDLEA try to tackle this at two different ends. One, supply control, and then the other is the demand reduction. We've seen so much work being done on supply control, but I want to talk about demand reduction. Last year, that was December, where the chairman of NDLEA said that we have about 14.3 million Nigerians abusing drugs. In terms of figures, where are we now? Are we progressing, or do we have more people now using drugs as well?
Well, there's no way we can. Don't forget that those figures came out from the 2018 drug use survey report that was public. That was an evidence-based statistics. But since then, it's supposed to last for 5 years. There has not been a new one, and indeed that came up in the speech of the president at the commemoration event today, and even that of the UNODC country rep asking and praying and supporting the next drug use survey that indeed would give us another picture of what the situation is at the moment in the country. That's really saying that, okay, with all of the great work that NDLEA and its partners and stakeholders done in the last 3 years, especially. Let's see if we can get another drug use survey report, survey that would show the impact and the effectiveness of all of these efforts, both at the level of supply reduction, at the level of demand reduction. And we do hope, and we're praying that another one will be held, another survey would take place. It's only then that we can say precisely what the situation is. But at the moment, we can only rely on the efforts of the agency on the field, out there on the street, whether in terms of the number of arrests that we have made. All those information, the facts, the figures are out there already with over 52,000 arrests in the last 3 years. When it comes to providing support, treatment, and counseling with over 33,000 persons benefiting from that also in the last 3 years. So all of these, there are things we can work with at the moment, but indeed, the nation as a country, we need another drug survey, which will give us the exact picture of what the situation is at the moment. So that will be my direct response to your question.
And let's talk about treatment, because you actually touched on it, and that report, the UNODC reports also touched on it. Just only, 1 in 11 people are getting treatment, according to that report around the world, which is really low. And we understand that in Nigeria, we do not have enough treatment centers. And people have said, look, law enforcement is not, we're over-relying on law enforcement, and that's not enough. What's been done in that regard in terms of treatment and having more centers?
Yeah, absolutely. I'll tell you that indeed we're very, very much on top of that, and we're glad that we're getting support from various stakeholders. Definitely, like I said, in the last 3 years, we've had more than 33,000 persons that have gone through our treatment and counseling centers. That's 30 of them across the country. And indeed, in the statement, in the welcome remark of the chairman of NDLA, again at the event today, he indeed say that 30 new model centers will be added to what we have this year. That will increase the figure of centers where people can actually get treatment. And in addition to that, another good thing happened today, and that was the launch of the Save Our Families campaign, SOF, which is to provide, create early detection, create awareness for that will enable early detection. And when you talk of early detection, that would also lead to treatment. So that's another great step, which we believe will help not only in early detection and creating opportunity for interventions and treatment, but would equally serve as deterrent, which would at the same level, the same time, reduce or prevent drug use. So these, in addition to the massive awareness being created through our whole society approach under the War Against Drug Abuse Social Advocacy Initiative.
And let's circle back to supply control, which is where we've seen, we take that report almost every other day of people who have been arrested at different locations, carrying drugs, one type of drugs or the other. In terms of your findings and investigation, how far-reaching are these cartels, and what are the challenges to, really just putting a stop or controlling supply?
Yeah, definitely. We know that, if you also go back to the statistics that the agency has rolled out in terms of the drug supply reduction activities that are interdiction efforts, that's also encouraging, with more than 50,000 arrests and including 48 bails. That's a lot. I'm not sure that's, if not the highest in anywhere in the world under 3 years, that would be one of the top 3 anywhere in the world. And in addition to that, we see more than 9,000 convictions. Also, if not the highest in the world under 3 years, that should be one of the highest in the world. And when you look at the seizures also, that the figure is also very encouraging. That's more than 7.6 million kilograms of assorted illicit drugs also seized within the same period. This goes a long way to show that indeed the efforts to tame and curb supply, it's really, really far-reaching, and it's really making impact. And we know because we have We have means through intelligence and other technological means to monitor the activities of these cartels, and we know that indeed they are feeling the impact of the work of the agency, and that's why you see every time they try to rear their ugly heads, we are always, steps ahead of them, whether at the airport, at the seaport, at the land border, or even on our streets and our communities.
And one must say that sometimes even at personal cost to your men. Thank you so much for your time.
Absolutely.
Director of Media and Advocacy for NDLEA, Femi Babafemi.
Thank you. It's always my pleasure.